When I think about burnout, I kind of think about burnout as death by paper cuts. Nurses,
Mm,
everybody has bad days, things that are nuisances to us, things that don't make it go well. But it's when it's happening all the time and then we're not able to recover from it that I think that death by paper cuts analogy kind of comes to mind. I think one of the best ways that we can combat burnout is really by having great relationships with our staff and being very intentional and having thoughtful conversations with them. At OSF St. Francis, we do monthly mission partner rounding. So very intentional, purposeful rounding that the leaders are doing with their frontline staff, asking them the things: what's going well, what frustrated you in the last couple shifts that you worked at, what problems have you experienced, how can I help, how are you doing at home, how are you managing with the stress of all of this. I think we have to understand where the nuisances are and the pain points and really work to address each one of those things, because it's not one little thing that causes burnout in nurses. It's oftentimes many things. The other thing that I think we need to put more focus on is more micro debriefings at the bedside. Nursing and healthcare is a profession where you could be coding a patient in a room for an hour and have that patient pass away, and you immediately walk out of that room and walk into your other person's room with a smile on your face. That's not normal. And we don't oftentimes give ourselves, as the clinicians, the opportunity to process what happened, the opportunity to talk things through. And especially, I think, if you're a newer nurse, taking the time to get the assurances that you did a good job and that you did what you were supposed to have that support. I came from a long line of nurses in my family. My mom was a nurse, my aunts are nurses. I debriefed almost every day after I left work. I think we need more of an intentional structure to help new people acclimate better into our profession. The work we do is really hard.